Hi, welcome to our video today. I'm really excited to share an interview with you with Dr. Joharchi, who's an amazing psychologist who's based out in California. Before we do that, please remember that if you're liking this video and the interviews that are going to be coming up, please, like, but more importantly, subscribe so that you don't miss out on more information. She's an Iranian-American and white cisgender psychologist in California. She specializes in serving LGBTQ people from all backgrounds who are healing from traumatic experiences. Today, she graced us with her presence as we talk about how parents can support the mental health needs of their children when they are in the LGBTQ community. We also touched just a little bit on parents who themselves may be transitioning and thinking about coming out to their families. Dr. Joharchi has joined us on our blog here at Playfully Psyched, and she wrote a great article about how parents can support their children. And she talked about it from an inviting in, as I just used that phrase, coming out. We want to change that from coming out to really inviting them in. So please check that out and see more about her there. And then we'll give you information about how to contact her. And you'll also find that below in the comment section. So hold on to your seats and let's get ready to meet Dr. Joharchi. Welcome, Dr. Joharchi.
Thank you so much, Dr. Data. Thank you for inviting me.
It's so lovely to have you with me today. So we're going to talk a little bit about your work, what you do as a psychologist working with people in the LGBTQ community. And we're just going to kick it off with, what's your favorite part of the work that you do?
Absolutely. I was just talking with someone about what it feels like to connect with someone in a reparative way. So I guess when someone comes in and they reveal some of the wounds that they need some healing around, some ways that no longer serve them, and when we're able to connect and repair some of that, there's something magical that happens in that therapy session that is certainly my favorite part of therapy. Now, sometimes it happens right away. Sometimes there's some patience there. So I kind of also like the art of the journey to get there too.
Mm-hmm. So interesting. So I know that you work with some children and you work with parents as well. What are some things you suggest for parents who have a gay, bisexual, lesbian, or transgender child in their life?
Yeah, great question. Thank you. So, it may sound sort of like duh, of course, but, just I really recommend that they love their child the way that they would no matter what. So loving children in general the way that we would no matter what is so important. We also want to let them know that they can be who they want to be. So we don't want to necessarily like bring on the fear and, oh, well, I'm scared that you might have this happen to you or that this can happen or blah, blah, blah. Those are, it's not to say that we can't feel scared and protective, but it's just to let them know that they can be who they want to be. And then we're going to want to also support them to be around safe mentors and mentors who are in the community and perhaps leaders. So studies actually show that when we connect LGBTQ children and adolescents with LGBTQ mentors, there are better outcomes. And then I really work with parents and caregivers around advocating for their children and adolescents in the school systems. So talking with, your child's teachers, with your child's principal, and helping them in the school system could be really helpful. And then the other piece is as they get older, you're going to have the opportunity to accept their friends and their partners. And that's going to be another source or display of love, right? Just, of course, knowing who your child's friends are and accepting them into your home can be a huge display of acceptance of who your child is. And then we're going to also want parents to and caregivers to help their family members to accept the child. So kind of if aunts or uncles or grandparents are using old names for the child or maybe not knowing or not accepting who they are, a big piece of what we would want to do to help the parent and support the parent in therapy especially would be to advocate for the child within their own family. And then, of course, if they can get their own help or their own support, sometimes to talk about the way that they see their child, the way that they expected things to be, some of the griefs or experiences that might come up for them, to process that with somebody not their child, right? To process that with a therapist or a really trusted person. And I'm sure I don't need to say this, Dr. Dalton, but I have worked with some folks where they've been hit or verbally abused because of being LGBTQ, because their parent didn't accept who they were. And so I'm talking about acceptance in a lot of different ways within communities, within school systems, within family systems. I also want to say, we also have to treat our children with safety. And these are fragile souls, and we have a big opportunity to accept them and help them feel love no matter what. Um, and while it could be easier said than done, no hands, no hurtful words, that kind of stuff, right? And then, I also really suggest that parents be mindful of what they tell their child or teen to inhibit and not inhibit. So, what I mean by that is sometimes I've noticed well meaning caregivers trying to protect their child within, let's say, a family system. But we have to kind of be mindful of is it worth it to go to this family party where I'm telling my child not to be who they are so that we get to go? So I think kind of really thinking about the implications of that, because there is literature out there that says that when we accept our child and let them be who they are, even at a family party, especially at the family party, right, where they could get more support from certain people sometimes, that can be helpful for later outcomes. So basically, no asking them to keep secrets. I mean, that could be super detrimental, right? Even if you and I think about if someone asked us to keep a secret about who we are, how does that make us feel? I don't feel so good about that. So we don't want to make kids feel that way.
That was so amazing. This is such amazing stuff because, sitting here listening to you, I think the first thought was, well, most parents try to love their kids, right? But then you really gave some really concrete ways about what that could look like. And I love that you brought in the piece about sometimes families are grieving. So just because they're trying to love their kid the best way they know how doesn't mean that they're going to be okay initially with learning that their child is LGBTQ, right? So you kind of said, mentors, making sure that the child has mentors in their life, support for the parents to be able to process and explore their own feelings and thoughts about the situation, and creating healthy peer groups for their child. Just some really great gems that I think can be really helpful for families. And then thinking about this idea of letting their child be who they are, and maybe that means some family functions either aren't attended or that they're kind of ready to roll their sleeves up and jump to their child's needs whenever that arises at a family function.
Yeah, thank you so much for hearing that with such grace. I mean, really, the last one, as I'm hearing it reflected, I'm thinking, well, yeah, we definitely don't want to isolate the family member from their supports as well. So if that means rolling up their sleeves and kind of figuring out a way that we can have family come together, then yes, absolutely. So thank you for reflecting that.
Yeah, absolutely. Wonderful. So far we've kind of talked a little bit about, children and teens, so kind of the older ends of childhood. I'm a little bit wondering, what can parents do when their child or teen is transitioning or coming out? And what might this look like for a younger child?
Yeah, I'm happy you asked that. I actually love working with folks who are kind of unpacking some of their own beliefs and roles around gender because their child at this time is coming out. And so this isn't anything new. I think it's so silly almost when the media pretends that this is new, that young people are coming out younger and younger. Um, there have been, for many, many years, young folks saying, like, I know who I am, right? And so these parents or caregivers who can sort of hear that out and either access a therapist or check out your website or check out mine and just kind of gain some of those resources early on are really doing a great job, right? So we want them to be able to unpack their own understandings, beliefs, roles, ideas of what it is to be any particular gender, what it is to be non binary, to not be a binary sort of gender and somewhere in the middle or on a spectrum, and what it looked like for them as a child. And so, sort of unpacking that and looking at their own stuff can be super helpful. And then, of course, I'm sure you've heard of it, parents, families, and friends of lesbians and gay people. PFLAG has some really great resources for parents and caregivers of young children who are coming out. Also, finding an LGBTQ friendly therapist could be helpful. So, either an ally or a therapist who themselves identifies as LGBTQ can be helpful in helping a parent support their child.
Wonderful, wonderful. Okay, so those are really helpful things that you talked about for transitioning or coming out. Does it look different for a child who's maybe 3, and parents that maybe 3 or 4 or 5 that's like struggling with um, what do I do? How do I support this child through that? Is that appropriate? Am I pushing my own beliefs onto them? Am I just doing things that they're going to change their mind? This is going to harm them or scar them forever. What advice or what tips would you give for parents when children are, you know, in those preschool phases and uh, questioning or already saying, there's, I can't remember her last name, but there's Jazz is really popular. I guess now she's a young adult. She's not a teen anymore. But she used to have this thing where she'd show a video clip of her, I think being 3, and she'd say like, I have a boy body but a girl brain. And she's 3 years old trying to tell people like, hey, here's who I am. Um, any tips that you would give for parents that are in that situation?
You are asking the hard questions. I really love that question, Dr. Doughton. I really like the way you're making me think here. Yes, I do have a big tip for parents who have really little ones who are exploring or who are saying they are who they are, like Jazz did. Um, my biggest tip would be to get out of the way. And I don't mean that in a rude way. I mean that in the kindest, warmest way from the bottom of my heart that if we let 3-year-olds be 3-year-olds, they can do it. I mean, look, when I want to play, I look at a kid. I figure out like, okay, this is how, like, they know what to do. They know how to play. They know who they are. And yeah, maybe there's some exploration and they're figuring it out. Again, we can just get out of the way. It's okay. And totally understandable if there's like concerns and all that. I totally talked about how we can get some support for folks who are concerned. And in the meantime, like letting children play with the toys that they choose, letting them express themselves the way that they want to express themselves in safe ways, like through some social transition, meaning like the hairstyle that they choose, or the colors that they want to choose. for their clothing. So there are little things that we could do, and some of this is easier said than done. Okay, so I just want to take note of that, right? So there are, like, for example, if I'm just thinking, in my own, if I'm looking at my own gender stories, right? In my own family of origin, right? Like with my dad being Iranian, my mom being white. If my dad would have seen one of us girls, the daughters, dressing like a boy, that'd be different for him than if he saw a son dressing in girls, right? Because there's all sorts of clothing. Um, so, I am understanding of the fact that there are intersecting identities. I am understanding of the fact that we do have concerns and we do want to protect and care for and love our children. And again, I just go back to the idea of like getting out of the way. If you have your own stuff, we don't want it to impede our next generation. And that's okay. Like, that's okay. But there are other providers, Dr. Downton or myself, right? There's PFLAG, there's supports out there for you as the parent in order to just be a channel of love for your kid. So easier said than done. I understand how complex it can be, but there's stuff we can do.
Yeah, no, beautiful. Well said. Well said. See, you have your advocacy hat on for little ones out there. Love it. Talk about difficult questions, though. So, kind of go to a difficult one and see what you have to say about it, what your thoughts are. So, I have been seeing a lot lately that there have been several states trying to establish laws that would make it illegal for medical providers to help children through transitioning. What advice would you have for parents in those states regarding their mental health needs and the mental health needs of their child who isn't allowed to transition with things such as, with puberty blockers or things like that? So, what would you tell these parents whose children are going to have some mental health needs, most likely with their rights to transition and be who they are being taken away or being, jeopardized?
Yeah, I agree with you. Talk about the hard questions. Yeah. This is, can I just say this is horrible? Yeah.
Yeah, it is. It
It's
is.
scary to see. So, um, there have been other places where I've worked where this was already a concern, like in different states in the US where this was already a concern. And what we did was we worked with a lawyer. It's kind of outside of my scope because the person needed care, and we worked with the legal team to be able to support the child. And so, the other thing that can be done is if you're working with a hospital system, sometimes there's a medical legal partnership that can help someone access medically necessary care. And then the other aspect is social transition, right? So, in the meantime, regardless of where someone is at medically, we're going to want to talk about social transition, right? So, internal and external presentation and expression is something that someone could get started on right now, with or without blockers, puberty blockers or hormones or any sort of medical intervention. It's not to say that it's good enough. It's just to say that, like, if we ignore the piece of social transition, we're missing an opportunity to do something that might help the child present themselves as they are right now and be sort of congruent with themselves.
Mhm.
So, socially transition, I kind of touched on it a little bit earlier, but just sometimes it can be helpful to start from internal to external if the child's still trying to figure out kind of what works for them. So, they may feel like wearing panties before necessarily, like, on the outside wearing a dress, or not. Sometimes kids know, like, this is going to work for me, this isn't. Or they may feel like changing their name and not going on puberty blockers. So each person is different and it's going to look different for them, but there are things that we can get started on right away that can kind of like, while work with some of these weird legal issues.
So, as a therapist, it sounds like what you're saying is that for the mental health piece, the social transitioning is a way that you can help support the family and what you would be helping the family kind of think about. Hey, we can't, you might not be able to directly help with legal stuff, but we know that social transitioning can help children get the effects of like depression or anxiety around how they're presenting to kind of help them through those situations. Would you have parents make these suggestions to their child directly? For example, should parents present choices? Should they say like, hey, while we're kind of thinking this through, and like we thought about this before, but when we go to the store, right, we can look at things that maybe, you can choose things that only you can see or know about, like underwear choices, um, or in the wintertime, like painting your toenails. But you can also, or you could look at things that you want to show yourself to the world, such as like, the colors that you wear, painting your fingernails, the clothing style. We can shop in this section versus that. Should parents give those concrete examples to their kids, or is that something you would suggest? Or like, I guess, how do they help their child express what's happening internally and what they want, make those step-by-step changes for themselves?
It's a great question too. So I'm thinking that as I think about some of the cases I've served over the years, I cannot think of one where the child didn't already know, like, I want to do this, that, or the other. So I think that if I ever met a caregiver where they were kind of giving some ideas and helping out, that'd be great. And at the same time, like I said, like I've always just seen children from really little to adolescence and young adulthood, sharing what they really wanted. And then it was kind of up to like, um, sort of parents to get on board, or if they weren't going to, then we would talk about it in therapy and see how we could help out with that. But I so wish that the climate of our society wasn't so oppressive, with so many factors, right? With racism, with access to care, with the legal issues around accessing trans care, accessing gender health care. With all of these issues, it it's so helpful if there are parents that are already kind of having some options, because if the systems are sort of oppressing the child, then if they can have an ally with a caregiver, I can only imagine the healing. And it's not just me imagining and seeing in my personal and professional experience, but also the research saying that this is what can help children feel more connected, have less rates of suicide, have less rates of substance abuse. You just recently sent me an article, Dr. Dalton, about how consistent positive support of an LGBTQ child can really protect them from these future risks. So we have an opportunity to heal some of the oppression out there, by doing things like letting our kid wear panties or cutting their hair the way they want it done. So, big question. That's really important. Thank you.
No, thank you so much. That's a great, great. I think would be really helpful for parents, in this stage of their life and their child's life. Speaking of which, so I think things are changing now for sure. But something that I used to get all the time is that, being a person who does some specialized therapies for really young children, um, people would say they're a child. They don't need therapy. Like they'll be fine. They're resilient. Kids are resilient. And that has definitely shifted, but I'm wondering how much that has shifted within the LGBTQ family setting, right? So, what would you say to parents who are wondering, should I give my child therapy?
Yeah, good question. Again, yes. Yeah, if you can, right? It doesn't always have to be therapy that's healing. There can be other sorts of therapeutic like relationships that are extremely healing. And yes, accessing mental health care is perhaps a tragedy. I mean, it's like super. crazy hard to access mental health care for some folks. And if you have the option to access through, Medicaid, Medicare, um, Open Path, PFLAG, or your health insurance otherwise, private pay, out of pocket, out of network. Yes, absolutely. We know that it kind of links to my last answer in that we know that these type of relationships can help and heal. Um, and if we do it at a younger age, we can prevent this sort of intergenerational trauma. We can sort of prevent some of these really sort of riskier things like suicide and substance abuse.
Wonderful. Would you suggest that parents who have a child that's LGBTQ kind of automatically think about therapy as part of their package of, helping them navigate through life in these earlier transitional times?
Yeah, so yes and no. I would love for therapy to be for everyone, and like that we all just go to therapy. And at the same time, I feel concerned to say yes because I don't want anyone to think that they need therapy in order to get medically necessary treatment. So, I think that if a parent has access to services, then great, and they can kind of work with their psychologist or their therapist to see if that means just a quick check-in or if that means long-term therapy or something in between. And if they don't have access, there are, like I said, other sorts of avenues to therapeutic relationships.
What I heard in that response is your hesitation to try to put therapists in a role of gatekeepers for access to other types of medical treatment. And so I love that you talked about that because that definitely was not the direction of my question at all. So I think that was really good. I hear you saying that medical treatment or medical access includes mental health, but that should not be the step in order to transition in some other way. Okay.
Yeah.
Right?
Well, just yeah, I'm exactly because I think that's my sort of stuff as the cisgender psychologist at the Gender Health Center of Santa Clara County. I'm over there thinking, how can I be less of a gatekeeper than I already am over there, right? So when providers ask me, should everyone get therapy? What should happen? I kind of always explain like people don't need therapy in order to get this letter. WPATH, World Psychological Association for Transgender Health, WPATH, states that they need to meet with somebody to indicate that they can consent for hormones or consent for surgery. Do I think that years from now that we're going to need that? No, I don't think we need it now. I think we need it in order to get insurance authorization. So I'm really happy to kind of touch on this part about gatekeeping because I'm hoping that I'm always aware of, my role at the Gender Health Center or my role even in private practice with trans folks. So thank you for bringing that up.
Mm-hmm. No, I think that's great. I think, yeah, because you have such a different experience than I never worked in a gender health clinic. And so my thought process is always in the mental health space and not so much about the gatekeeping. I'm not signing letters about, that's not it, but it's about helping navigate and support someone in a transition in their life. So I think we could all benefit. Like teen years are hard, right? Going into from a teen to an adult is hard. Different phases of adulthood is challenging. But I think that on average, most people could benefit from some sort of transitional support system in these major changes that we have in life. So I really appreciate you for kind of thinking about the gatekeeping role in the LGBTQ community. The other piece of that question that I had for you was, what are things from a mental health perspective, so not the gatekeeping perspective, what are some things that you have found was helpful for parents to look for that are clues of like, oh, maybe a therapist would be really helpful to help my child through this? help my LGBTQ child through this?
Yeah, sure. So cues could be stuff that parents could know that we might not know about their child, right? So all of a sudden they're being way quieter than they normally would be, or they are maybe more guarded than they would be, maybe more irritable, right? Some of the behavioral sort of things that annoy people, we may actually look a little deeper and see that actually they're just really sad and grumpy, feeling isolated and like they don't have too many peers to support them now that they're sort of socially transitioning or out or whatever. So, some of those things that might get kids in trouble a little bit at school or with adults might be the very tells that give us a sign that, hey, saw so and so drinking. Maybe something's up with them. Or I saw so and so really down and blue and just sort of hanging out by themselves and not talking anymore. Maybe something's up with them. Um, so just being inquisitive and being curious about some of these shifts and changes.
Being active observers in their child's life and trying to pick up on major changes that maybe their child isn't talking about with them or expressing. Um, and they can always start with kind of exploring those noticings with their child, and then if that's not working or in conjunction with, they could seek therapy services.
Great point.
Is that what you were saying?
Yes, thank you. Mhm.
Um, okay. So you have some experience with parents coming out to their adult children. We're kind of shifting the idea of childhood right now, right? What insights or tips would you like to provide to either in childhood or in adulthood, children who are learning about their parents transitioning, or for parents who are wanting to come out to their children?
Yeah, yeah. This is actually a place I really love to serve as well. I've noticed that sometimes when a parent can get their own support and again, sort of explore their own gender roles, what it means to be who they are in the world that they live in, and what it means with their other intersecting identities, that can be really helpful to explore. Just seen people really open up and share quite a bit around their life story with gender throughout their lifetime. And then also doing that before they maybe share with their kids that can kind of be helpful for them. And then I think one of the main things I've seen be helpful is to affirm to their adult children or their children that they won't be abandoned, right? And there's a couple different ways we can do that. Directly validating that, yeah, this might be different or, you know, maybe even surprising, shocking, and I'm not going anywhere. And I'm right here, and it doesn't have to be mom's right here or dad's right here or parents right here or grandma's right here. It's just I'm right here, right? And we don't have to get super caught up in what do they want to call me now and all that. Like that can all be negotiated after they know directly and are affirmed directly that, yeah, this person is not going anywhere. So one, just validating um, the surprisingness or the feelings that might be coming up. Two, affirming that they will not be abandoned. And then three, affirming that for themselves internally, whether or not they have a therapist to walk through their gender roles and their gender journey, affirming to themselves that no matter what happens, they will still be there for themselves. I know some of this stuff sounds cheesy, and we know that this can be really helpful, knowing that they themselves will not abandon themselves, especially if they had to suppress for a certain amount of time. They will no longer be doing that. Um, so there's those pieces. Let's see. I've also heard, and I love to hear what you feel about this as well. But I've also heard people say we can kind of also tell someone. Let's say there's two people in a relationship and they have a child, right? We've also heard that these two people, if they plan to stay together, should also tell their child we will be staying together. This doesn't change us. I have some mixed beliefs about that because I don't know if we can ever promise that. But I've heard that. So I just want to throw that out there in case that's helpful for anyone. Not sure we can promise that to children or to adult children, but if that's how someone feels in the moment, sure.
No, I love that you brought that up. Like, we can't promise that. And I think as adults, we have a tendency, very often, many of us, not everyone, to make promises because how we feel so authentically in the moment. Um, and then we're stating it in a way that sounds like it's actually forever, right? And so, like what you're describing is that just because that what the parents maybe are trying to say is that, oh, this part isn't going to affect our relationship, but like we don't know if they have other types of problems in their relationship or reasons why they feel like they wouldn't get together down the line. And so, how that's interpreted or how that's shared with the child can be, you know, could go either way, I guess. Um, what I think is important, what you were hitting on, and I was like, yes, 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 is this idea that maybe the parent is saying something along the lines of like, how people look at me is going to change. How people maybe look at our family structures may change, but that's the outside looking in. My relationship with you, how we interact together, how we treat one another, how we talk to one another, that's not going to change. I'm still going to be here. So the between here and there doesn't change, even though people looking in, that might change. I think that's so powerful. I'm so glad you brought that up, right? It's that idea of I'm not going anywhere. Um, I want you to know this, and we'll navigate this together about how this changes other aspects of the external part of our family, but who I am to you as your parent is who I am to you as your parent, right? And doesn't change any of the memories that we've created in the past together either.
Absolutely. Hmm.
Well, it's been so lovely having you. I am going to include your contact information when we post this video and this audio. But please tell the viewers how they can contact you if they have more questions or if they want to seek therapy services with you in California, they want presentations or interview or whatever. Let us know how we can get in contact with Dr. Joharchi.
Absolutely. Thank you so much for this wonderful opportunity to just dialogue with you about how we can better support our communities and also these really thought-provoking questions. People can contact me either through checking out my website. They can access content through the blog, through the books that I talk about, through softheartpsychology.com. So again, that's softheartpsychology.com. They can contact me, check out blogs, schedule a free consultation. I'm located in California, and I love serving our community. So please reach out.
Awesome. Thank you. Thank you so much for joining today, Dr. Joharchi. And I look forward to future communications with you and maybe another interview down the line.
Yes. Thank you so much, Dr. Dalton.
Oh my goodness, wasn't that amazing? We were able to spend so much time with Dr. Joharchi learning about how to support children and families who are part of the LGBTQIA+ communities. Dr. Joharchi has some really great things to tell us about children and families who are in that transitional spaces for themselves within the LGBTQIA+ community. It was just wonderful to have the opportunity to talk with her and to really think about things from a perspective that I don't always think about. I also work with children in the LGBTQIA communities and parents as well. But one of the things that Dr. Joharchi talked about was that idea of gatekeeping and the harms for that. And so that brought a different perspective in a way that I hope gets that message out there to families. So if you didn't get a chance to, go back, rewatch, rewind, save it, share it with others. All right? Thank you so much for joining us here at Playfully Psyched. And remember, I really hope you take a moment to play a little today. Bye.